Hi, I'm Abhishek, and today I'll be talking about my project, which was the cost analysis of an ACL reconstruction, which was done through a systematic review. Before we get talking about the ACL, let's take a step back and learn more about the knee in general. The knee is made out of many different ligaments, cartilage, tendons, and muscles, such as the meniscus, the MCL, the medial collateral ligament, and the ACL, or the anterior cruciate ligament, all who come together to give us the motion that we know in our knees. Today, we'll be focusing specifically on the ACL, or the anterior cruciate ligament, which is located in the middle of your knee and acts as a stabilizer. This allows you to do for your jumps and lateral cuts that you see in sports or your everyday life. ACL injuries are hypothesized to happen due to a neuromuscular control deficit during dynamic movements. This results in excessive loads on the joints, which then strains your ACL. In simpler words, from repeated repeated explosive motions such as jumping or cutting side to side, your ACL gets strained, and with too much strain, it can lead to either a sprain or eventually a tear. This is most commonly found in sports like basketball or soccer. Once diagnosed with an ACL tear, patients normally opt for an ACL reconstruction, but it's important to note that you can also live without your ACL. If you're choosing reconstruction, you have the option for an allograft or an autograft, which may be taken from the hamstring or patellar tendon, depending on which option you choose from. After surgery, recovery involves monitoring and treatment depending on the complications that may arise as a result. This is often followed by physical therapy, which can help return to your which can help you return to your pre-injury levels, as seen with athletes and many of the other people who get ACL injuries in their lives. Now that we know a little about the ACL, we can now explore the purpose of the systematic review, which was to understand the financial implications of an ACL tear. To do this, we utilized the PubMed database and created a set of inclusion and exclusion criteria to guide our papers. Papers that were written about ACL injury written in English and were consisted of an economic analysis were key to our paper. These papers later focused on athletes and workers, comorbidities, the effect other tears have on the cost of ACL tears, as well as innovations that are leading us to have more efficient treatments. Papers that were excluded often were non-peer reviewed papers, other review papers, studies published before 2003 as advances made in the field by them. After that may lead to those findings being outdated, studies not conducted on humans or with a sample size of 25 or fewer, and if they're written in a country other than the United States or were commentaries or letters to editors of other papers. With these criteria, we were able to have an initial 483 papers to scan through. Our exclusion and inclusion criteria took out 328 of them, leaving us with 152 for retrieval. Out of 155, 123 were behind a paywall, leaving us to ignore those papers as our main audience was high school students, and high school students may not have access to those paid articles. With 32 articles, with 32 papers, 10 papers failed to mention costs or how they achieved the results, leaving us with 22 studies included in our final review. From those 22 papers, we were able to have 5 key points. Quality of life out. 7 studies focused on the quality of life after an ACL tear, looking at societal impacts, complications, and post-surgery happiness. Key indicators of quality of life included injury to the surrounding areas, such as the MCL or the PCL, all of which not only added to cost, but also added how long it would take to recover. Another aspect was the ability to return to work, as through the treatment options such as therapy or surgery, physical therapy was needed and to return to pre-injury levels. And the amount of time for that varied based on how early you were able to catch your injury on top of other factors. Overall, 6 years after our research also found out that 6 years after ACL injury, on a scale on a quality of life scale from 0 to 1, patients reported a 6-year quality of life of 0.6 to 0.7, with one being the highest you can be, being perfectly healthy. Quality of life saw a decrease when compared to pre-injury levels. Another point that I came across was the risk of injury itself. Out of the six studies that focused on this, they all came to the conclusion that gender was the biggest factor in ACL injury, as female athletes, especially in high school, have a 5% chance of injuring their ACL alone. This is due to hormonal and biomechanical differences between men and women, as during the period cycle, wo- female athletes have fluctuation in their muscular imbalances between their quadriceps and hamstrings, on top of other things which influence their increase of injury. On top of gender, genetic factors further contribute to the risk. Ways to In order to reduce the risk of injury, it's important to measure knee abduction angle, and ground reaction forces during landings in order to help our athletes decrease their risk of injury. 11 studies explored the long-term effects of ACL injuries, focusing on factors such as meniscal tears, post-surgery treatment, and recovery strategies. Long-term effects included impaired knee function and a higher risk of osteoarthritis, especially if the ACL tear was combined with an MCL tear. On top of that, pain management often included opioids like oxycodone and hydrocodone, which posed increased risk for addiction. Combining pain management with physical therapy improved muscle strength and knee outcomes, reducing the need for ACL revision reducing the need for a second ACL tear. Following an ACL reconstruction, another key issue was psychological, as many athletes suffered kinesiophobia, or the fear of movement, affected long term which affected recovery as well as produced long-term trauma. On top of long-term effects, three studies addressed strategies for reducing ACL injury costs. Key factors included the choice of reconstruction type, which such as allograft, which affected the long-term treatment, long-term costs as well as short-term costs, as well as the treatment strategy. The longer you stayed in the hospital, the more costs you accumulated. So it's treatment strategies that treatment strategies that are able to get you out of the hospital as quickly as possible tend to be the most cost efficient. Effective strategies that are being used today are like using nerve blocks for acute pain management have shown to save money for both patients and hospitals by not only decreasing surgery time, but also decreasing outpatient time spent in the hospitals, and also reducing expenses in the long term. Overall, studies show that low volume providers handling fewer than 52 cases annually tend to have higher expenses compared to higher volume providers. Another big cost factor is delayed diagnosis, as most ACL tears are initially diagnosed as sprains, and the longer they're diagnosed as sprains compared to a tear leads to them having a delayed diagnosis, and resulting in an increased cost of treatment as well as further injury to surrounding muscles, surrounding areas of the knee. From these five criteria points, we're able to finally put a number to the cost of ACL tear through rehabilitation, physical therapy, diagnosis, surgery fee, and anesthesia, on top of many others. The overall cost came almost 350,000. But with this number, it's important to know the limitations of the study. The costs all came from one source, and we know that cost is more of a broad number, and it's important to know, and further research is required in order to come with an exact number. These research papers also didn't take account of inflation when using their methodology, so these numbers may not be exactly accurate to the current day pricing. It's also important to understand that the prices of today may not be the prices of tomorrow, and the prices of tomorrow are nowhere close to the of the future. Technology and medicine is constantly changing, and as time progresses, ACL recovery and surgery will become more efficient and will be able to be done in a more faster setting, leaving workers and athletes to be able to return to work at a faster rate. And with these, there's also unknown costs. We're not able to put a cost to everything that athletes and everyday workers are going through. And some of these things are priceless, such as time spent away from family, time spent from recovery, and overall the quality of life. So, in summary, ACL injuries have varied roads to recovery with a number of implicit and explicit costs associated with their management and treatment. This systematic review uncovers factors that highlight a disparity in management and treatment options that should be further studied. For future work, studies that look it would be helpful to include it would have studies that look at the opportunity cost of regular people and what having an ACL injury does to their future salaries and future and their ability to work. It's also another key aspect to look would be great to look at would be what can you no longer do or how is this ACL injury affecting your work and are there any other costs associated with that? Looking into construction workers and how their jobs are affected might also be an interesting work case to follow through. So taking a step back, it might looking at how race, ethnicity, and socioeconomic status affects ACL costs might also be an interesting viewpoint or interesting place to take a look. And finally, it might be also interesting to see how having an athletic trainer in the area can prevent injury, as having an athletic trainer might be able to produce proper technique and form, reducing the amount of stress placed on your ACL. Thank you for listening, and I hope you guys enjoy the presentation.